So here are some flashcards regarding to fetal hematology. So subunit composition of minor adult hemoglobin HbA2. Subunit composition of minor adult hemoglobin A2. It will be alpha 2 and delta 2. Then the chain that replaces the gamma chain after birth, it's the beta chain. Impact of transitioning from hemoglobin F to hemoglobin A on the oxygen curve is the right shift. Impact of transitioning from fetal hemoglobin to hemoglobin A on oxygen curve, it will be the right shift. Site of erythropoiesis at 24 weeks of gestation, it will be bone marrow predominantly and liver or spleen. Reason for hemoglobin F higher oxygen affinity. The reason for fetal hemoglobin for higher oxygen affinity is the low binding to 2,3 BPG. Lower binding of 2,3 BPG. That's the reason for higher oxygen affinity of fetal hemoglobin. Then the shift of the oxygen dissociation curve in HbF relative to HbA is left shift, because hemoglobin F binds to more oxygen than the adult hemoglobin. So the shift of the oxygen dissociation curve in the hemoglobin F relative to HbA will be left shift. Then the secondary site of erythropoiesis between 10 to 28 weeks is spleen. Erythropoiesis between 10 to 28 weeks occur in spleen. Predominant hemoglobin type in 6 months old infant is HbA. In 6 month old infant, hemoglobin predominantly is HbA that contains alpha 2 and beta 2 chains. Then globin chain synthesized continuously from early embryogenesis to adulthood, that is alpha chain. So alpha chain is the global chain synthesized continuously from the embryogenesis to adulthood. So it will be present in embryogenesis as well as in the adulthood, that is the alpha chain. Structure of embryonic hemoglobin Gower 1, it is the zeta 2 and epsilon 2. Zeta 2 and epsilon 2 hemoglobin Gower 1. Physiological purpose of fetal hemoglobin high oxygen affinity to capture the oxygen from maternal HbA across the placenta. What is the purpose of the fetal hemoglobin? That it carry the high affinity for oxygen. The main purpose is to capture the oxygen from maternal HbA across the placenta. What is percentage of HbA2 in a normal adult? 2 to 3% HbA2 in normal adult. Subunit composition of adult hemoglobin. Subunit composition of major adult hemoglobin, that is HbA1, it contains alpha 2 and beta 2. HbA1 contains alpha 2, beta 2. Primary site of fetal erythropoiesis from 6 weeks to birth. So where the RBC production, where the erythropoiesis occur from 6 weeks to birth, in the liver. 6 weeks to birth in the liver. Embryonic globin subunits include zeta and epsilon. What are the embryonic globin subunits? Zeta and epsilon. Timing when the beta globin synthesis begins to exceed gamma globin. What's the time when beta globin synthesis begins to exceed gamma globin? It's the shortly after birth. Shortly after birth, the beta globin synthesis starts to exceed the gamma globin. So beta globin synthesis will be more than gamma shortly after birth. Globin chain used in HbA2 is delta. What is the globin chain that is used in alpha in the hemoglobin A2? It is delta. First site of fetal erythropoiesis in 3 to 8 weeks. First site of fetal erythropoiesis in 3 to 8 weeks of gestation, it is yolk sac. Primary site of erythropoiesis at 12 weeks gestation is liver. At the 12 week of gestation, the primary site of erythropoiesis is liver. Relative oxygen affinity of hemoglobin F compared to HbA. Higher affinity, because the fetal hemoglobin have higher affinity for oxygen than HbA. Mnemonic for the order of fetal erythropoiesis synthesis site. So for the erythropoiesis sites, the mnemonics is young liver synthesize blood, yolk sac, liver, spleen and bone marrow. In this order: young liver synthesizes blood, yolk sac, liver, spleen, bone marrow. Then the final and primary site of erythropoiesis 18 weeks to adulthood. It is bone marrow. From 18 weeks to adulthood, the final and primary site of erythropoiesis is bone marrow. Effect of 2,3 BPG on hemoglobin. It decreases the oxygen affinity, promotes unloading. Effect of 2,3 BPG on hemoglobin. It decreases oxygen affinity and increases unloading. Subunit composition of fetal hemoglobin. It is alpha 2 and gamma 2. Fetal hemoglobin contains 4 chains, 2 alpha and 2 gamma. Alpha 2, gamma 2. And the alpha always use rule. Alpha globin is present in all normal hemoglobins after the early embryonic period. The alpha always rule. Alpha globin is present in all normal hemoglobins after the early embryonic period.